Hi, everyone. On behalf of MCIC, the Manitoba Council for International Cooperation, I welcome you to tonight's edition of our Local Brews and Global Views discussion. Before we begin today, I want to acknowledge that the land where we're hosting this event is the traditional territory of many indigenous communities, including Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples. And we're on the homeland of the Métis Nation and on Treaty 1 territory. We are grateful for the opportunity to host this event. For those who do not know much about what we do, MCIC is a council of about 40 member agencies working in international development worldwide. We also work to connect Manitobans on global issues. This event is sponsored in part by funding from Global Affairs Canada, and we're very grateful for your support. For those joining us for the first time on this series, we've had very interesting and insightful conversations on global issues and the varied ways that organizations seek to address these issues. Today, I also want to acknowledge that today is the International Day for the Elimination of Violence Against Women. It is an annual event that raises awareness on the prevalence of gender-based violence globally. Today also begins the 16 Days of Activism, a global campaign to end violence against women and girls. So back to our agenda for tonight. Shortly, we'll be learning about an empowering initiative that addressed some of the challenges that persons with albinism encounter in Tanzania. So albinism is a rare genetic condition that affects people globally. Studies have shown that persons with albinism suffer discrimination as well as social exclusion. This means that their ability to actualize their full potentials as human and enjoy their few human rights are severely hindered. In 2013, the United Nations Human Rights Council adopted a resolution that called for the prevention of attacks and discrimination against persons with albinism. And the council further created the mandate of the independent expert on the enjoyment of human rights by persons with albinism. So June 13 of every year is International Albinism Awareness Day, a day set aside to celebrate the achievement of persons with albinism and promote their human rights. Tonight, I'm delighted to be joined by Anita Odoni from ADRA Canada and James Bisheko-who from ADRA Tanzania. Anita is the Emergency Program Director for ADRA Canada, and James is the Project Director for ADRA Tanzania. I will now turn this over to Anita and James. I think Anita would go first. Anita, thank you for being here. Over to you.
Thank you very much, Oluchi. I'll start also by recognizing the land on which ADRA Canada sits. ADRA Canada is situated within the traditional and treaty territory of the Mississaugas and Chippewas of the Anishinaabe, known today as the Williams Treaty First Nations. As you rightfully introduced us, we'll be talking about albinism, which is a relatively rare condition. And this project, Escape Project, is one that addressed some of the issues that people living with albinism face. This presentation should have been by my colleague, Peggy, who was not able to join us today. She traveled to Nunavut with another colleague for a monitoring trip for ADRA Canada. Unfortunately, they got caught up in a storm, and they were delayed for 2.5 days, but today they made it safely to Ottawa and will be flying home soon. So I'm going to introduce ADRA Canada and then ADRA Tanzania. And that's when my colleague James Bisheko will come in. So ADRA Canada is part of the ADRA network. The ADRA network, ADRA stands for Adventist Development and Relief Agency, and we are in over 113 countries around the world. We work as a network doing relief and development work. And we have various offices, some of which are supporting offices or donor offices, so to speak, and others are implementing offices. In this case, ADRA Canada is a supporting office. When we received a request from ADRA Tanzania, our implementing office, about the challenge that people living with albinism are facing, we looked for funding and partners to support us. And when we got the resources, we sent them over to Tanzania and they were able to implement the project. So my colleague James Bisheko is here with us. It's 4 a.m. in East Africa. Thank you, James, for joining. Though people with albinism represent a relatively small segment of the population across the globe, they are disproportionately affected by poverty, particularly in developing countries and least developed countries. Moreover, they face multiple and intersecting forms of discrimination on the grounds of disability and color, and are often excluded from public policies in the key areas of health and education. Women and girls with albinism face unique and compounded discrimination on the basis of gender. Despite the documented statistics, using the birth rate with albinism of 1 to every 1,429, it has been estimated that there are approximately 40,588 people with albinism in Tanzania. Tanzania being one of the countries that has, I believe, most people living with albinism. In some countries, primarily in some parts of Africa, such as Tanzania that we are talking about, where people with albinism are hyper visible, as you can see in that photo. The physical appearance of people with albinism has been the object of erroneous beliefs and myths influenced by superstition, witchcraft, or both. Witchcraft-related myths have fostered acute marginalization, social exclusion, and physical attacks. Related harmful practices include accusations of witchcraft, killing, maiming, rape, grave robbery, trafficking in persons, and trafficking in body parts. Women and children with albinism are particularly vulnerable to violence, including sexual violence, which is often driven by harmful myths about different things. And despite these severe forms of persecution and discrimination, people with albinism are often denied justice and face barriers to accessing effective remedies of human rights violations. People with albinism are entitled to civil, political, economic, social, and cultural rights recognized in international humanitarian rights law. The International Convention of the Elimination of All Forms of Racial Discrimination and the Convention on the Rights of Persons with Disabilities are particularly relevant here. And both guarantee protection against discrimination. Equality and non-discrimination are essential human rights for people with albinism. But unfortunately, even if these rights are international, it doesn't really happen in some parts of the world. The Early Skin Care Awareness, Prevention and Engagement, ESCAPE, which is the project that James Bisheko helped to run, and the project that we are presenting today, was implemented between April and July 2021 in Tanzania with the support from ADRA Canada, Health Partners International Canada, HPIC, Manitoba Council for International Cooperation, MCIC, ADRA Africa, which is ADRA's regional office in Africa, and 2 Seventh-day Adventist Church unions in Tanzania, and ADRA Tanzania, of course. Those kids that you see there are holding their lotions that will help their skins to prevent from getting sunburn, which often leads to cancer. Escape Project established an effective collaborative platform involving 4 local entities in managing skin cancer clinics. Skin cancer is extremely common, very highly common with people living with albinism. ADRA worked with Standing Voice UK to provide sun hats and medical doctors. Tanzania Albinism Society to mobilize the people living with albinism, and district local authorities to provide venues for clinics and deploy welfare officers to support the program. On the other hand, and ADRA provided the logistics, ADRA Tanzania provided the logistics in form of transport, sunscreen lotions, as well as addressing challenges of people living with albinism. Though short, the Escape Project has created synergies for future engagements. This collaboration underscored the reality that we are stronger and more effective when we work together as partners. So this project was working to address skin damage and disease in 740 women and 694 girls under 18. This is a lady who has been under the sun. That's the effect. The project also reached 414 men and 513 boys under the age of 18. Escape also provided 501 hats and medical doctors, thanks to Standing Voice UK. Tanzania Albinism Society mobilized the people living with albinism, and district local authorities provided venues for the clinics and deployed welfare officers to support the program. This shows the planned activities and the results of the activities. Basically, what we've summarized: getting the medical checkups, receiving the lotions to help with their skins, and the hats to prevent from the sun. So this reached all ages, as you can see. The young toddler there, the boy, and the older lady. There's a quote here that you can see: "I do not have enough words to thank ADRA." And of course, ADRA is the face that they see, but all the partners that work together, for the beautiful gift they have given to my friends and me with albinism. Having access to ADRA's mobile clinic and a sunscreen distribution at the same time has been an honest answer to prayer. Thank you for touching our lives. After going so long without protection, ADRA has come to our rescue. That's from Victoria, one of the project participants.
To many, the sun is a source of life, as it provides them with light, vitamin D, solar energy, makes plant leaves to produce foods. Even some studies suggest that the sun increases people's level of happiness, totally the opposite for persons with albinism. Albinism, which affects as many as 1 person in 1,400 people in Tanzania, is an inherited genetic condition that reduces the amount of melanin pigments formed in the skin, hair, or eyes. This condition leads to poor vision and predisposition for skin cancer, which is said to be the silent killer for persons with albinism, reducing their life expectancy to as young as 30 years in Tanzania compared to 40 years in the rest of the African continent.
Stigma is there. It is just as a normal situation because we who are in this situation are stigmatized by many. When we pass, they spit on us that, what kind of people are these? If you meet a pregnant lady, she will spit off so that she does not give birth to a child like you. But in my family, I thank God, they have not stigmatized me, not even my grandchildren. But there are slanderers. Slanderers are there. You can just pass by and find someone spitting at you. Now what are you going to do? What are you going to do to them? What are you going to tell them? You leave them because they are also God's children. Even I did not like to be like this. I would have loved to be just like those stigmatizing me. But God didn't make me like that. Now what will you do? Will you sue them? You just leave them. We are worthless to our black counterparts. We have no value at all. This I'm telling you truly before God. We have no value, not even once.
Hatuna thamani hata mara moja.
The available figures show that more than 18,000 people live with albinism in Tanzania.
My name is Adija Shabani. Thank you, ADRA, for helping us with the skin oil.
A vulnerable community, such as people with albinism, are hit even harder by the pandemics, such as the current COVID-19, that has rendered even the most privileged helpless.
My
name is Japhet Andre Manyika. I am from Balawala, and this is my story. In 2009 October, I was working in a farm and a few men approached me. I didn't know why, but then it got clear to me that they wanted to cut off my arm. And so while defending myself, I started to run. I ran so fast, and while taking a sharp corner, I hit my face on a wall of a house. I survived, but then I had hit my face so hard, and I had a wound near my eye. I didn't know at first, but when I started attending the hospitals, they said that I needed to be transferred to KSAMC. I reached a KSAMC and they examined me, took part of my skin so that they could do more lab tests, and when the results were out, they told me that it was cancer and that they needed to remove the whole eye if I was to live. And so I did allow them to remove the whole eye, and that's why I am here today. That is why Adventist Development and Relief Agency, ADRA in Tanzania, with a mission to serve humanity so all may live as God intended, and has had several other objects with the people with albinism, is implementing early skin cancer awareness, prevention, and engagement project, also called the ESCAPE project, that is sponsored by ADRA Canada, Manitoba Council for International Development, ADRA Africa, the Seventh-day Adventist Church, and the Health Partners International Canada. Schools have just opened, and we are very sure that the children who receive the lotions will feel safe walking to and attending schools.
Wow, that was very empowering project. Thank you so much for sharing, Anita. I just have one question for you, Anita. There was something that you said that I would like you to expand a bit. But before then, I was wondering just how many, maybe James can help with this question. So I know there are many districts in Tanzania. So I was wondering if this was a national project. If not, like how many districts were you able to reach? How many states? Or was it a national project or not?
Tanzania is a big country in terms of expanse of land. We had planned to actually serve only 6 regions out of 26, and we got too many calls when the people with albinism got to know. We've been working with them before on other activities. They were all calling saying, okay, we are worse off too. If you probably listened to the video, there was this to say that they had spent so long without receiving any lotions, and that was also partly because of the COVID-19 situation. So they had spent close to 1.5 years. And most NGOs which used to operate were not able to bring in with the support. And we really would like to thank Canada, MCIC, ADRA Canada, and the HPIC for the support, because it came in when it was most needed. So we reached finally 9 regions out of 26, and we still continue to receive calls for this kind of lotions and medical camps that we were able to deliver. So the need is extremely high. Of course, we are also working with other partners to see if there could be local solutions too. There was also a partner who was actually making lotions in Tanzania, but when the COVID-19 situation came in, they were not able to continue as well. So you can imagine the challenge they faced even with the children having to go to school.
Anita's presentation touched a bit about how this project helped families with albino children. So I was wondering if you can just maybe shed more light on that, about how this project supported families.
It should, of course, be appreciated that, and we should again look at the frame of the timing, where COVID-19 affected everybody, but now these are people that were depending on aid so much, so to say, and the children who get exposed to the sun. And most of these children are looked after by their mothers or grandmothers. In some cases, the men or the fathers of the children actually run away, especially if the first child is, when they get a child with albinism, some still think maybe this is a bad omen, so they leave the women to look after these children. So we are talking about a very vulnerable community, even before COVID, and now they have no livelihoods to lie back on, and then they cannot go out to work because they are not protected. So this was very timely, very helpful, and that's why most of the beneficiaries were actually female, because we targeted these women who must go to fend for the children, and then of course the children. So in a way, that's why that woman, when she's speaking in the video, she's really very passionate about this kind of help. But allow me also to mention what she said. That touches my heart. All my life, about 18 years now, having worked with ADRA, I've been working in the most hard-to-reach areas and working with the most vulnerable communities, some indigenous communities too. But I find this particular community, because of the stigma associated with them and the myths around what albinism means, when that lady speaks and says, we are worthless, we are dealing not only with a physical or health problem, we're also dealing with discrimination. And I should say it's one way to really give a smile to somebody that really has not had it in a long time.
James, does ADRA Tanzania have other projects like livelihood projects, agriculture projects too, that support families of people living with albinism? Or this is a gap?
ADRA Tanzania, thank you. ADRA Tanzania has been doing more of child sponsorship for these children to be in school and be accepted and have the supplies we are talking about. But we have also recently started activities in the area of access to employment, because even the few girls and boys that we have been supporting through school, they do not easily access employment. And that is also partly because they are discriminated against. They themselves don't believe in themselves. So we train them and give them empowerment lessons, train them on how to even make applications, and those are very few. And then now we have also embarked, we have one other small project that is supported by the Polish government, and it is also looking at business skills training to see if they can also start their own small businesses, because most of them are depending on farming, and somehow farming exposes them more to the sun. So we're looking at alternatives. And yes, we are doing other activities besides health. And we are learning that the best way really sustainably have them access the services is to have them be in charge of their own lives through livelihoods.
Yes, thank you so very much for that response. And thank you, Anita, for that question on livelihood. I have some questions here, but as you were speaking, James, I also remember the conversation I had with Anita and Peggy as well. And from all these conversations, what really seemed so obvious is the fact that those with albinism, persons with albinism in Tanzania and elsewhere, but in this case, you're looking at Tanzania, they are doubly impacted both by the climate and the culture. And it's sad to think that because of the culture, they are further marginalized, where, you know, as a result, they are exposed to other forms of violence, such as direct forms where they could lose a limb or two. So this brings me back to one question, something that you already touched on. And I think I have one question here from someone. I think I'll go with this first. So the question is that we understand there was a shortage of sunscreen lotion during that pandemic when you started the project, that is. So can you tell us like how much sunscreen cost in Tanzania, you know, maybe during that time? Because we understand that as a result of this project, people had access to this very expensive commodity that was needed at that time to keep them safe from, you know, skin cancer. And related to that question is one other question that I have here. What kind of treatment options are there for skin cancer in Tanzania?
Thank you for the question. In terms of the cost, the $120 would give you 240 grams of sunscreen lotion, which used to be close to about $80. Now it's more expensive to have sunscreen lotion. So you need let me get back with my mathematics again quick, just to say that one tin of 240 grams would cost about $12. So that's the correction I'd like to make, $12, and that is extremely expensive. And that lasts on about 4 months for an adult. So that was extremely very unbearable for this particular community. So these lotions were being grabbed, I should say. Everybody came. We actually got more people than we could serve. But we decided to target more communities and institutions, including schools, where we had more children, and of course women had a bigger share that we had to ration it because of that. So I should say that was a big gap that we needed to fill, and we thank you for the support that we got.
Thank you very much for that. So I think I have one question here with regards to the video that we saw about the woman who suffered abuse. So the question here is so I was wondering if you can speak more to the young population and their relationship to those with albinism.
The treatment options was not answered, James. What are the treatment options for skin cancer in Tanzania?
There are no non-treatment options right now. There are two things we need to do to take care of. We are looking more at the preventive methods, having these hats and long sleeves. But the treatment options, why I'm saying they are not really there, because what is there is not affordable by the very people we are supporting. They have to go for cryosurgery or surgical provisions, and the distances between where these people stay and the cities where these facilities seem to be located very far and they have to incur so much to go there. And these services are not free. So the common person really doesn't have that much opportunity. So we are trying to concentrate a lot on prevention. And there are also a few referrals that are being made, and there are partners that are also supporting a few of these cases for treatment. And mainly it is about surgery. Cryosurgery methods also help with stopping the growth of the cancerous skins or skin particles, but that is also a new technology. It's not yet expanded. You have got to do an outreach clinic where you find these people and help them from there, because most of them cannot afford to go to the big cities where the hospitals are, and the dermatologists also are not everywhere. You'll find them in the regional referral hospitals, and again, not that much accessible. So prevention seems to be the way to go, and some service providers and NGOs, mainly like Standing Voice, are helping with the outreach clinics, but of course that is not as much sustainable.
Thank you, James. Anita, did you have something to add to that, to what James just said?
No, not that to that specifically, but in relation to the question on how much it costs for sunscreen, and it's $12 for a pack for one person that would take them for 4 months. Would you say, James, what is the average income of those most vulnerable people, like over household? How much would their income be per month in order to see the affordability of $12 for one person with albinism? And some of them have maybe 3 or 4 family members that need that protection, just to get that comparison there.
Thank you for that question. With the unemployment rates, even for the and people without albinism, here one would say the average income for a person that does not have really full-time job, because of most of them are really doing casual and working on the gardens, it's about $50 a month that they could earn. So certainly health or skin cancer treatment and these lotions become a luxury given the amount that they get. So about $50 would be the income for a person of this kind. And we have also engaged them and interviewed them. That's what we get.
Okay, thank you. So I think I have another question for you, James. And Anita, feel free to jump in if you want to add to this. So the question is about the legal provisions in Tanzania that protect persons living with albinism. So are there legal provisions in Tanzania? If yes, how are they enforced? If no, are you planning to maybe lobby for enactment of one?
Thank you. Incidentally, Tanzania has more instruments that would really protect people with albinism. And the reason is Tanzania, about 2013, 2016, had many cases of people being murdered, like you could see in the video, and the gentleman who was running away from people that found him in the garden. And that was international headline. So the government put in place so many of these protection laws and bylaws. And the issue is now enforcement and how the person with albinism can benefit from these protections. The thing we are looking at now, even as we offer these services, is how do we help to create awareness about these provisions. In the video, you could see actually ADRA has a bus we use in these medical camps. We go with the doctors and move around. And we're thinking if we ever are able, we want to move around the country, create more awareness, first of all, demystify albinism, but also promote access to these rights and these benefit from these provisions that the government at a national level has put in place, because in the rural communities, they are not as much appreciative of these protections. And we need to bring these laws down to the common person who actually lives with the people with albinism.
So yes, thank you for that. So one thing that you said that I've been thinking about also is this the situation that was there prior to this period where we are, like, say, in the early 2000s. We heard a lot of stories and people did a lot of research on persons with albinism that were mutilated because of this culture where people see being different as something to fear. So I was wondering if how widespread that is currently, if it has changed, or if people are still being subjected to that sort of direct form of violence.
And in addition to that, James, very much related to that question is, are the youth getting better at relationships with people living with albinism and those without, or is it still status quo?
Well, it's not status quo. The situation has improved, one would say, greatly. And that's why interventions now that are meant to empower and uplift these communities from that position need to come in. There are a few cases of direct violence and all these attacks, few cases compared to that period that we are talking about. Occasionally you hear a few of these, but the people themselves are not that much empowered. The self-esteem is low because the stereotypes are still there. The names, the nicknames that they call them, some of them still call them that way. And so it takes really long for them to be accepted. I have been in Tanzania for 2 years. Originally, I come from Uganda, and I kept engaging people even at a higher level. And I understand not many people would even be willing to be served in a restaurant or in a hotel by a person with albinism. Probably out of 10 people, you may get one saying, I may accept such a service. So it's still a long way to go in terms of really making people feel that these are part of them, leave alone the stigma that they still carry. So they are no longer fearing that much. Of course, they wouldn't walk at night so easily. The girls would not walk alone so easily. So we still need to get there. They are not under attack constantly. Now it is the sun that is attacking them worse. But the society needs to accept them a little bit more and to have them engage in livelihood activities with a higher form of acceptance.
Oh, thank you. So something related to another form of violence that we see that is prevalent is indirect. So we've been talking about awareness, but there's something that is not being said enough, which is the mental well-being of this of persons with albinism. So I was wondering if there are projects perhaps that that are in place to address trauma or the mental well-being of a person with albinism, as well as addressing their family's health as well.
That's an area I think that needs a little bit more support. Most people are really onto this relief. And that's why now we are moving even into livelihood empowerment and so forth. The area of mental health, if you this video, we are still working on it and we'll be sharing it one of these days. The lady says we are worthless. If somebody thinks about themselves that way, is a big problem. And she goes ahead simply to say, well, we just have to forgive them. We have nothing to do with them. We didn't ask to be like this. And how I wish they would really accept that this is who we are, and we are equally in position to live dignified lives. So that's not an area that has been so much supported. I'm not sure that I've heard of any institution or organization that is looking at the mental health support.
Thank you. So Anita, as the emergency director for ADRA Canada, is that one area that you'd be looking to maybe develop some sort of intervention, maybe sometime soon?
Absolutely, absolutely. It's as James said, the needs are vast. And even following the questions that you're seeing, I really appreciate the participants' questions. How are we helping the families? Because the people with albinism are suffering and they are vulnerable, and but the families of those people also, the psychosocial support is needed. The livelihoods, there's so much, the gaps are many, but ADRA Canada is absolutely planning and willing and looking forward to partnering with ADRA Tanzania to make this happen. Resources are always fewer than the need. So maybe James can tell us what are the priorities that we can work towards so that we'll come knocking at MCIC door for additional funding.
Okay, just a quick one. Like I said, for sure, there are already opportunities for us to serve and support these people, especially the provisions that government has put in place. But most people are not able to benefit from them. For example, there are quotas set for people with disability. Now, albinism falls under is recognized by the constitution in Tanzania as a form of disability. So there are provisions that if you are people with disability, there's a percentage, 2% of the allocation in terms of funds that come to the region or the district, and the positions also for employment for people with disability. But now disability being a bigger kind of option to look at, then persons with albinism who are already stigmatized are not able to compete for this window. So having that government is willing to support, and they even have some small grants for businesses. We are now trying to see how do we support persons with albinism, that category of disability, to also compete for available opportunities and resources. So there is willingness down here. But I think the most important at the moment, of course, we need to continue to protect them, especially the children going to school. These lotions are still key, and the women that look after them. If we could have cheaper options to access these supplies. But I think the big one is the empowerment in terms of livelihoods, and that cannot happen unless they feel safe. So the awareness creation, promotion of their rights, the caravan drive that for us we think is going to make a bit of a change. And I have also seen that even Tanzanians, the population would be willing to support, but we need to really, first of all, let them appreciate what albinism is all about and how these people need to be accepted and supported. And if anything, I can see the people of Tanzania as well being able to contribute even financially to the survival of these children, especially in school. So yes, awareness creation, and then this empowerment is going to continue to be more relevant in this kind of arena.
Yeah, thank you. Definitely, I think what would work in this case is an intersectional approach that would address not just the empowerment, the livelihood, but also the mental health, education, as well as the needs of families with children that have this rare genetic condition. So I think that takes me to another question, if that is okay, James and Anita. Should I ask one more question? So you mentioned, you touched briefly on what I'm going to say, that this year's Albinism Awareness Day, the theme is, I think, strength beyond all odds. So from my earlier conversations with you and Peggy, now with James, we've learned that this project held because of these formidable alliances that you were able to build. So I was wondering if you could maybe talk a bit about that. And the second part of the question, while you're answering that, maybe Anita, I can help with this. I was also thinking if there are lessons learned that you would like to share, and maybe ways forward for those who are, seeking to carry out such projects.
This project was, I should say, was small and short, but it generated a lot of steam and so many partners. We are really grateful we are willing to come in and cover the gaps, because we had the supplies and the logistics to move these supplies to the communities. But just imagine if we were just going around and distributing without having doctors going along and doing the full clinics. So standing voice came in handy, and the government health workers that were willing to work with us. But it was also the task, our relationship with the Tanzania Albinism Society, which happens to have offices in all the regions in the country. Of course, they need to be strengthened as well. The partnership is just very right to do more. And then I should also say the SDA Church, which ADRA benefits from because of the network. It's very easy to work through religious leaders, and they mobilize. And we have found that to be a very good angle, where most people will even feel safer when they are invited, and they are able to participate in mobilizing and volunteering to bring about, to create awareness in the community. So the platform for participation is there. The area that we need to look at now is the private sector, especially the business community. And we are looking seriously at how to bring those ones on board, because the civil society is up in there, and the media, but the private sector, the business community, we need to work with and see that we bring this from one place where we are and see ourselves progressing. So we are grateful for all these partnership arrangements.
Thank you.
Yes, and your second questions for lessons learned and the way forward, and James, feel free to add on that. He also touched on it. One of the lessons, a little background of how we got to send a trailer load of these lotions was HPIC had a trailer load of these lotions, and they were most urgently needed in Tanzania. So as we heard, they can be manufactured on the ground. It takes some resources to ship these items. I think the lesson would be, if we can send the financial resources to the ground, that means that we get more people reached on the ground, and we get to also grow the local business on the ground. So that will be a two-pronged approach which will benefit more relevantly on the ground, and it will take away from the time spent in logistics and all that, customs clearance. So the more liquid support on the ground, the better. And then that would also, depending on the resources available, the financial resources and the expertise on the ground, allow for an integrated approach where you have the preventative measures taken care of, the hats and the long-sleeved clothing and the sunscreen lotion, and then you have the mental health aspect taken care of. You have the mobile clinics, and you have the livelihood support. So the more resources available, the more integrated approach and holistic approach, and also the more liquid cash on the ground, the more people will be reached. Yeah, the need is always greater than the resources, but as much as we have, we need to make sure it goes further. I don't know if James, you would add to that. Looks like you want to add to that.
Yeah, that is it. But there is another small project we are doing with persons with albinism, especially the ones from Dar es Salaam city. They approached us. They wanted us to provide food supplies because they were really having a hard time accessing food because of the impact of COVID-19. And unfortunately, we couldn't do that. But what we have done is to help the women, 100 households in the city, to grow vegetables around their homesteads so that they do not even have to walk far and expose themselves to the sun, and at least access vegetables from there. And some of them are now looking at starting to sell some of these vegetables. And it has caused a great amount of excitement, and vegetables grow very fast. We'll be sharing with you, I think, in the near future on the impact of this. But it looks like we really need to empower the person with albinism with a means to survive on their own, and probably maybe in the future they are able to access these sunscreen notions on their own.
Thank you so very much. This is such an insightful and very educative presentation. And thank you for being in conversation with me, James and Anita. I just want to say thank you for sharing the stories about persons who are affected by this genetic condition. And I think I'm speaking for every other person when I say we actually loved the presentation and the stories and the lessons learned. Thank you, James. Thank you so much, Anita.